What is the lurking cause behind genital warts and cervical cancer? What affects nearly half of all sexually active females between the age of 18 and 22? And what will nearly 90% of all women come in contact with at some point in their lives? The answer to all of these questions is HPV. The human papillomavirus strikes in a variety of ways. We've all heard of the genital warts. These stalk-like or cluster-like growths appear on the shaft or the scrotum in males, and also in the inner and outer vaginal canals in females. This highly contagious sexually transmitted disease can be transferred merely by touch. Sexual contact with an infected individual results in contraction of the disease 70% of the time, regardless of if any warts were visible at the point of contact. While we may be able to visibly spot those strains causing genital warts, what about those strains that cause cervical cancer? Males show nearly no signs of this virus when infected. The cervical cancer claims nearly 3,700 lives in the United States alone, and in countries with less advanced diagnostic medicine, claim even more. Cervical cancer targets healthy cervical tissue and alters the shape and the function of the cells. This change can lead to vaginal bleeding, abdominal pain, and in very severe cases, the leaking of urine and feces from the vagina. We can certainly agree that the symptoms of both of these STDs are far from desirable. So once infected, what are our options? Sadly, there is no cure. Just like all STDs caused by viruses, at this point, there are no known cures. As far as the strains that cause genital warts, the warts can be cut or burned away for treatment. However, this is a painful, expensive, not to mention embarrassing procedure. For females infected with a cervical cancer strain, their options, if caught early, are able to have that affected tissue scraped away or excised from the cervix. In more severe cases, typical cancer treatment options occur as far as chemotherapy and a cocktail of drugs. So if we don't have a cure, what do we know? We do know that there are nearly 150 types of the human papillomavirus. Some scientists argue there are upwards of 200 different types. These types are further broken down, genital and non-genital strains. There are about 30 to 40 genital strains, which are further subdivided into the types that cause cervical cancer and the types that cause genital warts. Types 10 and 16 cause nearly 70% of all known cervical cancer cases, and types 6 and 11 cause nearly 90% of all the genital warts cases. So by protecting ourselves from just these 4 out of 150 strands, we drastically reduce our chances of being affected by either of these diseases. So how can you, or your daughter, or your granddaughter protect themselves from these 4 strains? The answer is simple, with the Gardasil vaccine. These 3 injections are administered in your doctor's office, spread properly over the course of 8 months. So what's the catch? Well, no catch really, except that it has to be administered before the individual is exposed to HPV. As I discussed earlier, 90% of females will come in contact by the time they graduate college, meaning the earlier, the better. So some of you may already be convinced of the value of the Gardasil vaccine, but some may be worried about those pesky side effects. The side effects are very typical to all vaccines: headache, fever, dizziness, nausea, and in some more severe cases, shortness of breath, abdominal pain, and in very, very rare cases, seizures were observed. However, these side effects are no more serious than other vaccines and are actually less serious than the birth control pill. So if the side effects really aren't anything to be bothered with, what's the problem? Well, more conservative types argue that having this vaccine is a license for young girls to have sex. I have 2 arguments to this. For one, this is implying that all females that engage in premarital sex have STDs, or that if you choose to wait until you're married, that you won't be exposed to this STD. Even if you or your daughter or your granddaughter do the right things, did he? The heavy reality of the situation is that fewer and fewer people are virgins on their wedding night. Even though your daughter may be making the right decisions, why make her suffer because her other half didn't? Secondly, this virus is spread merely through touch. It doesn't even require penetration or sexual activity. Why make her pay for a silly mistake? Along those same lines, Alan Kay of the Cervical Cancer Coalition makes an excellent point. He claims just because you wear a seatbelt doesn't mean you go out searching for an accident. Just because your daughter's vaccinated doesn't mean she's going to go on ready to take any man that she walks by. Don't make her pay for your poor decision. Keep your daughter safe. Keep her safe with Gardasil. It's important that our children understand the values and realize that sexual activity should be reserved for someone that we plan on spending the rest of our lives with. However, peer pressure plays a huge role when you're not there. Don't make her small mistake affect you. Protect your child with Gardasil. Protect her from the incurable sexually transmitted disease. Small things can make a big difference. Okay, as always, my audience is my fiance.
Back again.